Welcome to Module 5 of Cornerstone's overview of the Medicare Ground Ambulance Data Collection System. My name is Jim, and I'll be your host as we move now into facilities costs and vehicle costs. Starting with facilities costs, CMS has broken this into three basic parts: facility information, lease/mortgage costs, and then insurance, maintenance, utilities, and taxes. Again, we're going to use tables here to help visualize things, and we'll take this one part at a time. In this table, you can see how CMS wants to see certain information for each of your facilities. On the next slide, we'll break down how CMS defines what an acceptable facility is, but for now, we'll just walk through these sections here, these columns. So first of all, for each facility, CMS will want to know if your agency or another agency rents it, if your agency or another owns it but has a mortgage, if your agency or another owns it outright, if the facility was donated. Of course, in those cases, there's no cost to acquire it, but there would be maintenance, utilities, insurance, and taxes. CMS wants to know the square footage, and then if a shared service, CMS wants to know the percentage of square footage that's attributable to ground ambulance services. As for what qualifies as a facility, you should include anything used for call center or dispatch, vehicle storage, and admin/EMT staff. You should not include facilities used by contracted entities that your agency does not itself occupy, such as a call center to which you pay a monthly fee for call services. Also, if you had one building in which all functions occurred, CMS says to list only that one building. In those cases where non-ambulance operations also occur, CMS states that you can use your, quote, best estimate, unquote. For agencies that are fire department based, do not include garage, storage, and staff areas used for fire response, but do include a share of office and common spaces related to both ambulance and other activities that is in proportion to your share of total responses that are ground ambulance responses, such as if half your calls are EMS, list half the square footage as the share. In regard to lease and mortgage costs, here we can see the areas of focus. So for each facility, CMS wants to know the lease or rental costs, the mortgage and interest costs, and also the annual depreciation if the facility is owned and there's no mortgage. Now, total costs in this context includes costs paid by another organization or entity on your behalf, and includes costs for facilities that were partially related to your ground ambulance operations. Of note, do not include facilities here that were donated or exceptions for which there was no cost. Also, be mindful not to include these interest costs elsewhere. Now let's move into insurance, maintenance, utilities, and taxes, where we can see what CMS is targeting. So as we look at the screen here, we see total facilities related insurance costs, total facilities related maintenance and improvement, utilities costs, and total facilities taxes. To break this down a bit more, total costs in this context includes costs paid by another organization or entity on your behalf. Total costs also includes costs for facilities that were partially related to your ground ambulance operations. Total costs does not include donations or exceptions for which there was no cost. And also CMS indicates as a reminder, do not include labor costs here if said labor costs were already included in the labor section. And also as a reminder, do not include any taxes here if included in the mortgage section. Okay, so let's get into vehicle costs. As stated earlier, CMS considers ground ambulances to include both land and water ambulances. CMS also wants to learn more about the non-ambulance vehicles used in relation to your ground ambulance operation. Finally, CMS has broken this into two main parts here: ground ambulance vehicle costs and other costs associated with vehicles. We'll start with the first part and refer to a table to help us visualize. Okay, so similarly to the labor cost table that we created, this vehicles cost table has two sort of overarching sections: ground ambulance and non-ambulance vehicle, which we've abbreviated to NAV or NAV. So those are on the far left, the vertical dark blue bars. And then within that, you can see that there are groupings for owned and leased. And then within each of these, there are specific questions. And so we'll just kind of go through this. So if it's a ground ambulance that is owned, CMS will ask, was it used to transport patients? Was it donated? If it was not donated, what is the annual depreciated value? CMS will ask, was it remounted? And if yes, what was the cost? CMS will also look for total miles billed and total miles unbilled. Sticking with the ground ambulance, if it's leased, CMS will ask, was it used to transport patients? What was the total lease cost? And again, total miles billed and unbilled. And then in the non-ambulance vehicle section, CMS will break that down by owned and leased again. And so if you own a non-ambulance vehicle, CMS will ask, well, what type of vehicle is this? And options will include a fire truck, land rescue vehicle, water rescue vehicle, and a vehicle that responds to emergencies, but is not designed to transport patients. CMS will ask, was the vehicle used to respond to ambulance calls or support ground ambulance operations? CMS will ask if the vehicle was donated. If it's not donated, CMS will want to know the annual depreciated value. And again, CMS will look for total miles traveled during the collection period. And then finally, in the leased subgrouping for the non-ambulance vehicles, CMS will again ask what type of vehicle it is, and then we'll also look to acquire the total lease cost. So there are a few items to note here as we consider this table. First, you will need to include all ground ambulances, regardless whether the ambulance transported patients or whether you billed for transports made by this ambulance. And secondly, more as a reminder here, you will need to track the total number of ambulance and non-ambulance miles. So for land ambulance, that includes billed and unbilled. And then for both water and non-ambulance, that includes any miles for any reason. Now on to other costs associated with vehicles. This section pertains to all vehicles, so ground ambulance and NAV, used to respond to ambulance calls or support ground ambulance operations. Here we can see that CMS is focused on registration, license and insurance costs, as well as maintenance and fuel costs. So for maintenance and fuel, the vehicle types that CMS will ask about includes ground ambulances, fire trucks, land rescue vehicles, water rescue vehicles, other vehicles that respond to emergencies but don't transport patients, and then other vehicles, something that wouldn't fall into any of those other categories. Also, as a reminder, do not include any in-house labor costs already included in the labor section, or any outside service or contract, which will be asked about separately. And that wraps up Module 5. We are now down to the final module, where we will take a look at equipment, consumables and supplies, other costs, total costs, and finally, revenues.